Pyloromyotomy, cutting of pyloric muscle, Fredette-Ramstedt type operation. The physician incises the pyloric muscle. The physician makes a small subcostal incision over the pyloric olive. The peritoneum is incised, the tissues are retracted, and the pylorus is identified. The serosa is incised and the tension of the pyloric muscle is released with longitudinal incisions. The peritoneum is sutured closed and the operative site is sutured in layers. Vagotomy when performed with partial distal gastrectomy. The physician uses a midline abdominal approach. The distal stomach, antrum, is dissected free and the blood supply to the antrum divided. The distal stomach is removed and the proximal stomach is sutured to the duodenum. Truncal vagotomy is performed by severing both right and left vagus nerves just below the diaphragm. Vagotomy including pyloroplasty, with or without gastrostomy, truncal or selective. Parietal cell, highly selective. The physician severs the vagus nerves and widens the pyloric canal, with or without making an incision in the stomach. The physician uses a midline upper abdominal incision to expose the muscular band surrounding the distal opening of the stomach. A longitudinal incision is made in the pylorus. The incision is closed with a single full-thickness suture layer. The two branches of the vagus nerve are exposed and a truncal vagotomy is performed by severing both right and left vagus nerves. A gastrostomy may be created by inserting a tube from the stomach to the external surface of the abdominal wall. Pelvic exenteration for colorectal malignancy, with proctectomy, with or without colostomy, with removal of bladder and ureteral transplantations, and/or hysterectomy, or cervicectomy, with or without removal of tube, S, with or without removal of ovary, S, or any combination thereof. The physician removes pelvic organs, with or without a colostomy, due to cancer of the colon and rectum. The physician makes an abdominal incision. The distal colon and rectum are mobilized and divided proximal and distal to the segment of interest. The pelvic organs are dissected free of surrounding structures and removed. The colon and rectum may be reproximate or the proximal end of the colon may be brought out through a separate incision on the abdominal wall as a colostomy and the remaining rectum closed with staples or sutures. The initial incision is closed. In males the procedure may include removal of the prostate and bladder. In a female, the procedure may include removal of the bladder and also the uterus, cervix, fallopian tubes, and/or ovaries depending upon the extent of the disease.